chair of Keep Our NHS Public and the Save the Lewisham Hospital campaign as well. Tony.
Thank you very much. Can everybody hear? Because somebody's saying they can't hear at the back. If you can't hear, you wouldn't know, would you? Anyway, I retired a year ago from my work as consultant paediatrician. I had the privilege of working with disabled children and their families, and the added privilege, of course, of defending Lewisham Hospital, which is still incredibly busy and incredibly successful. In my years in the NHS, we've always worked together with other agencies, committed to helping disabled young people to realise their potential. We in the NHS achieved real integrated care with other agencies. Our skill and our commitment in the staff was working together with patients. We don't need Simon Stevens or STPs to tell us what integration means. Now, as co-chair of Keep Our NHS Public, a job I didn't really plan for in retirement, the fight is on to save the very services that those families that I've worked with for 25 years rely on. This government is ideologically opposed to funding public services. It's contemptuous of staff working themselves into the ground. Instead of the integration it speaks of, it is disintegrating the NHS and social care. It's breaking apart the NHS and creating a system, as we've heard, where increasingly private companies make profit from our suffering. The government puts this through. This is such a wonderful day because so many people here show us that we've woken up. But the government has been peddling lies repeatedly. And one of them is that community care will replace the need for 30% of hospital beds. And what's the result? 15,000 hospital beds have been lost in the last 6 years. And in January, there were scenes of a child awaiting assessment for meningitis asleep on 2 chairs in casualty for 8 hours before he was even assessed. Savage cuts to community social care and to health visitors and school nurses and community nurses and public health and hospitals like Ealing, which has lost its maternity service and its paediatric wards, mean that the lie about community care has been exposed. Community care is not cheaper, it will not save money, it will not reduce the need for hospitals, and it needs massive investment, not cuts. Keep Our NHS Public is 12 years old, and we've been there for holding 3 governments to account. We've got local campaign groups up and down the country. Our principle is that we must unite on what we agree on to defend the NHS, not pathetically divide on what we disagree on. If we learn anything from the Conservative Party in their ideological hatred of the NHS and public services, we must unite to come together to demand a united call for a public service, publicly funded and publicly provided. We're proud of what we achieved today, proud of the demonstration, but the only value of coming here today is if we go away determined to get involved and join in the battle for our NHS and social care. I'm finishing now, but I heard an ambulance speaker the other night saying that she daily sees elderly people in their beds calling out an ambulance service having failed to have their social care visits, mentally disturbed people unable to get any care from social care. We demand on this demonstration public social care as well as public health care. So please resolve today to join us in tomorrow's battle to win back a comprehensive, well-funded health service and social care for all. Publicly funded, publicly managed and publicly provided, and see you soon in battle.